Janelle. How'd your visit go with Mr. Donaldson today?
It went great. It was Elizabeth and I that went, actually.
And he remembered our name this time. I think he's really getting used to us.
Yeah, I think the more you visit him, the more he's going to build a relationship and he's going to be more open with you. How's the care plan going?
It's going great. His blood pressure is awesome, and so is his weight.
Mr. Donaldson is not a real patient, but the care provided by community health transitional care interns is real. Our fictitious patient has congestive heart failure and was admitted to Florida Hospital due to a shortness of breath and generalized weakness. After receiving treatment and education, he was discharged and returned home. He also received assurance of continued personal care.
So I really enjoyed how Mr. Donaldson opened up to us last time.
I know, I noticed that too.
Today, 2 students enrolled in the Community Health Transitional Care Internship are making their regular visit to Mr. Donaldson's home. Federal government analysis shows that more than 1/2 of the cost of hospital readmissions for Medicare patients could be eliminated if the right care is provided. Care that includes in-person follow-up visits. Just as important as reducing costs is the real health benefit provided to patients by student interns.
We are able to see how a patient came from really down and not wanting to move and just in their home all the time to I want to go out to the community center and I want to participate with people my age. It feels great for us, but why it feels so great is because our patients are happy.
The Community Health Transition Care Internship is a partnership between Adventist University and Florida Hospital. It is available to all ADU students and enables them to apply the knowledge acquired in the classroom to practical work performed in the field.
The students actually go through a 14-week didactic portion of training, and they learn about HIPAA. They learn the basic concepts of skills. They learn about safety. And then they take those skills to a simulation lab that they spend 4 weeks simulating a home visit where they're asking questions of the patient and learning how to be comfortable in the home environment, in the home setting. All right, now that you've completed the classroom time and you've trained for the simulation, it's time to actually perform the simulation. This will make you comfortable for your home visits, all right?
Patient simulations are the step prior to making home visits. Here, students become adept at creating trusting relationships with patients. They also develop the skill needed to make accurate observations of how well the patient is following his or her treatment plan.
I think it gives us like a real life scenario of what can actually happen when we go out into the patient's home. It really gives us a better understanding of what to expect when we are actually going to be out in the field.
The CHTC internship provides students with 8 credit hours toward their degree, along with a minimum of 140 patient contact hours. In addition, it offers significant community service opportunities that enable students to minister directly to the healthcare needs of others. Dr. David Greenlaw says the CHTC internship also provides students with an opportunity to discover their most rewarding role in the healthcare profession.
In this particular program, students are going to interact with physicians, with nurses, with all kinds of healthcare providers. They're going to learn language that they never knew before about medications, about procedures and all of that. And for themselves now, they're going to be able to answer the question, am I comfortable here? So you begin to formulate for yourself your own understanding of where you can fit in a healthcare career and if you can make a contribution to helping other people.
The Community Health Transitional Care Internship prepares students to make healthcare a ministry of caring and compassion, the kind of ministry that reflects their personal values and brings healing to God's children. Lars Houmann offers a personal invitation to ADU students who are discovering God's will for them and how they can touch the lives of others.
This internship allows you inside exposure to one of the nation's best hospitals while providing you networking opportunities with some of the best healthcare workers in the industry. With this partnership, I know that ADU will continue to provide Florida Hospital with the exceptional employees we need to live out our mission.